Hey everyone, today's topic was over digestive orders and how fecal transplantation can help treat a variety of these different disorders. I enjoyed how Dr. Davis talked about how our gut being like a forest, and there's so much that we can do to harm the forest, such as burning it down, deforest, taking out all those good trees or our good bacteria with the use of strong antibiotics. Most people don't take their antibiotics as they should, and whenever you take antibiotics, it's gonna kill any bacteria unless you have a specific targeted one. But most practitioners, once you're sick or got something and you call for an antibiotic, they're just gonna give you a broad spectrum antibiotic, so it's gonna kill everything. While that may be good to kill what's causing you sickness, you're destroying the good bacteria that we need to have healthy bowel movements and healthy just having a healthy gut. When you kill those bacterias, you're leaving chance for super infections or opportunistic pathogens, such as C. diff, which, if you're in the nursing field, we all love. C. diff can happen after antibiotic use because there's not enough good bacteria to fight off the disease. So if you're constantly having to take antibiotics or immune suppressants, your chances of C. diff goes up. And if you're constantly killing off your good cells, you're not going to be able to fight it that well. I enjoyed how he talked about ulcerative colitis and like how the fecal transplant helped this child with it. For me, fecal transplant would just replenish all that good health, like what you do with probiotics, but this is just like a more, I want to say like a more invasive procedure, like a stronger response than just probiotics. And I think people get too squeamish with it because, oh, well, you're transferring fecal matter. Well, yes, but you're dwindling it down to like the 10% that's just bacteria and doing a retention enema to replenish all that. And it's just like with bone marrow transplant. You've done this chemo and this radiation and you killed off all your bone marrow that helps make your red blood cells and white blood cells and all those good things, and then you're replacing it with the donors so that you can have your body start to make those healthy cells and can fight infection and all that. So I feel like it's just the same concept, just a different route in doing it. I understand that most people want to say, well, feces, that isn't really safe to do all this, but in an article that I read, they said that 90% of their patients that were treated with this in the St. John's Hospital in Hamilton, Ontario, 90% of those patients were effectively cured, and there hasn't been a transmission of infectious diseases. And I think that's where people think too, well, you're going to have disease in feces. Well, you can have a disease in blood, but we still do blood transfusions. We're going to test. We're going to make sure that what we're giving to people is safe and effective. It asked about what factors might contribute to the digestive orders discussed in the videos. Well, with C. diff, you've taken too many antibiotics and now you're dealing with like no bacteria to fight off this infection. And with all those other bowel diseases like ulcerative colitis and Crohn's disease, your body's has an autoimmune effect. And your body's looking at all this bacteria in your stomach as bad, or the lining in your tract as bad. And so to transplant it, you're basically trying to teach your body that, hey, this is good. This is what we need to have a healthy bowel movement. And I think that we would have a lot more like successful success stories if we would do fecal transplants more. It's, you know, it's an enema. There's no IVs. There's no killing your immune system. We're just giving the patient new bacteria to help with their stomach. And I think this procedure has a lot of, well, it needs a lot more research, and it has the opportunity to be a very effective treatment option for those suffering with all these autoimmune disorders. Thank you.